Hello and welcome. My name is Rick Forlano and I'm the Executive Director of Arthritis and Osteoporosis WA. We're offering a three-part information webinar on COVID-19 and the older adult. And to present this series is consultant geriatrician and rheumatologist Dr. Charles Inderjeeth. I will now hand you over to Charles and we'll see how we go.
Thank you, Rick. The topic that I'm going to cover today is coronavirus and COVID-19, older populations, how to keep safe. So what do we know about coronavirus? And this brings to mind the infamous statement by Donald Rumsfeld when he spoke about the Iraq War. There are what we call known knowns, that is things that we know that we know. There are known unknowns, that is to say there are things that we know that we do not know. But more importantly, there are also unknown unknowns. These are things that we do not know. Unfortunately, with the coronavirus infection or COVID-19, because it is a relatively new infection, although it's from a class of viruses that we have been familiar with previously, with COVID-1, for example, there is very little that we know about its progress, whether there will be herd immunity, whether we'll get durable immunity, and importantly, whether we'll actually be able to find a vaccine that's going to work. This cartoon probably describes this condition better than I could in any presentation. It is a condition that has had a significant impact on life as we know it, and life as we know it may never be the same again. It has resulted in the shutdown of most usual activities. It has placed a significant impulse on our ability to have a social life, to work, to attend sporting events, and to be close to family and friends and do the things that we take for granted. The topics that I'm going to cover in this first of three seminars is the background and how COVID-19 affects the older population. In the second part, I'll cover high-risk conditions, medications, access to medical and health consultations, vaccines, infection control, and I'll touch a little bit on some of the newer research that's occurring. And in the third section, we will have a Q&A where I will try and answer some of the questions that have been put to us. In terms of the background, what is COVID-19? It is caused by a new strain of coronavirus that was first reported in December 2019, but was probably present prior to that in China. These viruses are from a family that usually infect animals, and through some mutation or transition has now jumped onto human beings through a process that's called zoonosis. The virus causing COVID-19 can be spread from person to person through a number of ways. First and most important is personal contact with someone who has the virus. And this contact with droplets from an infected person's cough or sneeze is probably very important as well. And these droplets can actually sit on surfaces for hours and up to days and can continue to infect anybody who comes into contact with the surface. There's an increased risk of morbidity in a number of groups, and most importantly, in those over the age of 70 years of age. And this group is more likely to have other chronic medical conditions that increase the risk of complications in people who get COVID-19. This includes chronic heart or lung diseases, diabetes, high blood pressure, and those who are immunocompromised, either due to the underlying disease or due to drugs. And another group would be those of the Aboriginal and Torres Strait Islander group who may be disadvantaged, and includes those with malnutrition and other medical conditions. Now, COVID-19 combined with other diseases is a bad combination. Firstly, older people are often compromised in terms of the immune system and are more susceptible. Multimorbidity is a major risk factor for complications, and 80% of those over 75 years of age have two or more diseases that afflict them. And those who have problems with their heart, lung, kidney disease, or diabetes can also have other organ systems compromised. So when a new virus such as COVID-19 is presented to the body, the other organs that are compromised are unable to respond adequately. Hence, the resilience of the entire body system is diminished, resulting in what we call multimorbidity and a greater risk of mortality. Probably the best example of a country or area that represents what we could expect in future if we are unable to control COVID-19 would be the European community. And this is the WHO European community data on cases and deaths in Europe. Importantly, in terms of cases, you can see that it afflicts all age groups. Younger people are more likely to get the condition because they are more socially active and more contact with the other people who may potentially carry the virus. However, deaths are more common in older people who are often frail, have comorbidities, and are immunosuppressed. And this is quite important from the context of the importance of isolating older people. Fortunately, older people already have less physical contact with other people, but this needs to be restrained even further if we are to reduce this high mortality in older people. It affects both genders, both men as well as women, more commonly in men than women, and all ages. So even younger people may be at risk of mortality from this condition should they be afflicted. And this applies mainly to younger people who may have comorbidities or conditions that result in a depressed immune system or medications that depress their immunity. This is the data from China showing the COVID-19 fatality by age. And importantly, as you can see, that mortality occurs in all age groups. But older people are more likely to have a significant mortality compared to younger people. And up to 15% of those over the age of 80 are likely to succumb to the disease. It is important to remember that high mortality is not equivalent to high infection risk. That these patients, irrespective of age or their underlying immunosuppressive conditions, are not at higher risk of getting the infections. However, if these people are infected, they're at higher risk of complications from COVID-19. Hence, risky behavior is one of the main drivers behind acquisition of the disease. And unfortunately, underlying immune suppression and frailty is a main driver for mortality in those who get it. So diligence with hygiene and personal distancing are important and does significantly reduce the risk of getting COVID-19 and the consequences thereof. So it is important to be clean. All surfaces that may have been contaminated need to be cleaned. It's important to wash hands regularly, and we talk about washing your hands for at least 20 seconds or singing happy birthday twice or something similar. It is important to use soap and water, and hand sanitizers, while not essential, are more convenient in circumstances where you do not have access to water and soap. When coughing, it is important that you cover your mouth and nose to ensure that there isn't widespread of the virus, and avoid close contact with anyone who has fever and cough. Hence the importance of social distancing, and a distance of 1.5 meters is the minimum, as it is the distance that will reduce the risk of someone coughing or sneezing and their droplets spreading to other people around them. Protecting against COVID-19 involves good hygiene, but also personal distancing. Hence the current rules restricting our ability to have contact with other people. We should avoid close contact with people who have fever or cough. We should stay at home if we are unwell. Minimizing physical contact with other people is one of the most fundamental ways of reducing the risk. And keeping a distance of 1.5 meters, which is equivalent to about 2 arms length, is important. For older people who are more susceptible to the consequences, reducing infection is important. They should avoid public gatherings, and importantly, try and get services delivered to them in their home rather than having to go outdoors to actually access these services. We should remember that this is all about personal distancing, not social distancing. In fact, it is important that we have closer social contact through other media with older people and others in the community, because mental health is an important component of this disease, and isolation does not help. Now, there's been a lot of controversy and discussion about masks, and we have a number of people who think they're experts, including presidents of countries, who have recommended against the use of masks. On the other extreme, some countries where there's a higher incidence of the disease or community spread have recommended the use of masks. And the CDC in the US have recommended the use of masks in the United States. So we need to put this into perspective, not only with surgical masks, but also with gloves. In Australia, the use of surgical masks is recommended for people with the virus to reduce their chances of them coughing, sneezing, or spreading it to others. It is also important for people caring for someone who has COVID-19, and this would include carers as well as healthcare workers, so that they do not get affected by the virus from those who they're caring for. In people who are otherwise well at the moment in Australia, you do not need to wear a surgical mask. However, the situation is fluid, and we will need to review this depending on the extent of community spread where this may need to occur. If you do not trust yourself to keep safe, it may not be unreasonable to wear a mask. The CDC in the US, for example, has recommended the use of masks in the US, mainly because there's a high rate of community spread, and it is one means of creating a barrier or a reminder to not touch your face or your eyes or to touch your surroundings. We should remember that gloves do not replace the need for personal and environmental hygiene, because gloves can get contaminated with coronavirus the same as hands. And like we wash our hands, we need to wash or replace our gloves, because any surface that we touch with a contaminated glove will contaminate that surface and increase the risk of COVID-19. At this stage, I'm going to pause this segment of the presentation, and after the break, we will come back to section 2, where we will talk about other aspects, including vaccination, infection control, treatments, and some future research. Thank you.